I want to take a minute to talk a little bit about what constitutes an ocular emergency and how we deal with that. Obviously, if you're struck in the eye with a bat, or someone hits you with a fist, or there's an accident and you take a blunt trauma to the eye or the head, obviously that can be very, very serious. We have to worry about damaged sinus cavities with that type of injury. We have to worry about bleeding in the eye or around the eye. We have to worry about separation of the tissue, and then ultimately, even if you recover from such a thing on your own, we still have to worry a lot about the swelling and how the eye recovers from such trauma. It's very, very important in that situation that you have an eye doctor look at the eye that's been traumatically struck, so we can evaluate really what is going on and if there does need to be any special types of treatment. Secondly, if you have ever experienced getting something in your eye, the nerve endings in the surface of your eye are very, very sensitive, probably at least 100 times more sensitive than the little nerves in your fingertips, and we all know how much a paper cut hurts. Well, a corneal cut or a corneal abrasion or a corneal injury is going to hurt a whole lot more, and it's going to feel like there's something in your eye. You're going to be very, very light sensitive. When we look at those types of injuries, we have to determine how severe and then how to treat it. But in the old days, we used a lot of gauze patches and we would tape your eye closed, and some people still do that. I found much more success using what's called a bandage contact lens. We basically put that in over the injury, and you can still see. You can apply medications to the injury, and that way it heals faster. You're able to see and work and function without all the pain, and you don't have to go around with a bandaged up eye as well. Last but not least, the most serious and sometimes most often ignored type of emergency is when someone sees a sudden change in their floaters. We all have these little fragments of proteins that float around inside the eye, and some people see more of them than others. But if you wake up some morning and you have a sudden change in those floaters, that can mean something new has broken loose and can be extremely dangerous and can even blind someone from the separation of the tissue. So a few floaters, not a big deal, we've all got them, but if you see a sudden change in floaters, you definitely need to have that looked at. And as a part of that same process, sometimes you won't necessarily see the floaters, but you might see lots of little flickers of light, like there's a little kid over there playing with a light switch and turning it off and on real quickly. Those little flickers can indicate that something inside the eye is pulling on the retina and trying to break loose, which could ultimately lead to a separation or retinal detachment and ultimately blindness. So, sudden changes in flashes, sudden changes in floaters can be more dangerous than one realizes, and definitely need to be evaluated. Besides those three main types of injuries, anytime you have a sudden change in vision or a vision loss, you might allow that to go for an hour or so, but if your vision definitely is changing, there can be a rupture in a blood vessel, there can be swelling in the nerve, there can be lots of things between the front of the eye and the brain that can go wrong and can cause a lot of serious issues. So if you do experience anything unusual in your vision, please see a professional to get that looked at.